Well, hello there. This is Mark Edelman, speech-language pathologist, and welcome to the teaching of talking. This particular video is going to be about what you'll learn if you decide to pursue study in the teaching of talking method. You know, the teaching of talking method is based on over 50 years of working directly with patients who have neurological speech and language difficulties, both children and adults. Now, there are a lot of people out there who are in academia or other areas in the field, and many of them have not had the day-to-day experience of seeing patients or clients all day long, you know, one after another for 8 to 10 to 11 hours a day. And so we're going to just speak about that for a minute. You know, being a speech pathologist for over 50 years, you just get up every day and you go do it. You know, you just get up every day, you get in the car, you go to your workplace. In my case, it was going to a hospital, going to an outpatient clinic, or even my own private practice that I had in Florida prior to hospital work. But the majority of the patients that I've seen over the years have had neurological related speech and language difficulties. Now, what I want to share with you is, what are you going to learn by being mentored or being a person who reads and studies the teaching of talking method? Well, there are a number of things you're going to learn. The first thing you're going to learn is rapport. Now, what's rapport? Rapport is getting on the same level as the person with whom you're working. Basically, kind of like becoming a friend. Not pushing them, but gaining a relationship. Because to me, speech therapy over the years is almost, first of all, about a relationship. You know, the caregiver and the person with aphasia have to like you. They have to look forward to being with you. And you have to like them and look forward to working with them. And what I've found through the years is that if you have solutions for people and you teach them simple methods, for instance, caregivers, you teach them what to do and how to do it, well, they go ahead and do it, and then they look forward to each and every visit after that because the person is gradually getting better. Now, so that's number one about speech therapy and about what you'll learn with the teaching of talking. You'll learn what we call communicative courtesy. And communicative courtesy is as having a courtesy or a respect for the individual with aphasia. So that when you're out and about or when the family comes over or anything like that, you're always treating the person with aphasia with respect and dignity. And if you can tell, especially when you learn about rapport, if you can tell that the individual with aphasia or apraxia is just kind of had enough, well, that's what you do. You stop and you rest and you come back later. So you've got to have your hand on the pulse of the person you're working with so that when you work with them, you can keep your eyes open and you can watch their facial expressions. You can listen to how they're producing speech. You can see if they're anxious, upset. You can see if they're having fun, if they're succeeding. And you learn basically how to keep your hand on the pulse of the person with aphasia or with apraxia so that they look forward to working with you and don't feel like you're just trying to bother them. Because there are a lot of people and a lot of caregivers and a lot of therapists who really don't know, who really don't have the experience of working with people with aphasia or with apraxia. And so what happens when that happens is they end up stepping on the toes of the person with aphasia. They're not comfortable. They feel like they're being evaluated, castigated, criticized, told what to do, told that they're wrong. We never do anything like that, because there are certain techniques that we use that if a person is off the target that we've set, that we get them back on target without any frustration, without any anxiousness, without just any upset, okay? So that it's always like a dance. It's sort of like, it is like a dance. You learn how to work with the person with aphasia, and not only do therapists learn how to do this, but so does the caregiver. And you learn the right steps to take, and you learn what to do if they have difficulty with a step. We show you what to do if they have difficulty to make it easier. And that's probably one of the major wonderful things about the teaching of talking, is that we make it easy. We make it easy for you, the caregiver, or therapist. We make it easy for the person with aphasia or apraxia, and we make it easy for the care person, or the wife, or the family member. Now, is it really easy? Well, it's not really easy. It takes concentration. It takes focus. But when you learn how to concentrate and focus, and you learn the right steps, after a while, it's like anything else. It's like washing dishes. It's like sweeping a floor. It's like mowing the yard. It's like trimming the yard. In the beginning, you really don't kind of want to do it. But after a while, you learn the ins and outs. You learn the shortcuts. And when you're done with the visit, or you're done with the therapy for the day, or the stimulation that you're doing, and you can see the smile of satisfaction on the person with aphasia or apraxia, and you can hear clearly spoken words coming out of their mouth where before they could not, then it's a wonderful experience, and it's fun and invigorating. I once had a woman who read one of my articles, saw one of my videos, and she said, "Speech therapy is not fun. You're crazy." But it wasn't for her, because the therapy that was done with her was not fun. And the therapist who worked with her was not fun. And the procedures that she used was not fun. And the way she was treated in therapy was not fun. So, I think speech therapy should be fun. And if you have a therapist who's not fun, and you don't like being with them, then you want to look elsewhere. It's just plain and simple. So what do you learn about the teaching of talking? What skills do you develop? Well, you develop the skill of rapport. You develop the skill of knowing what to do. You develop the skill of knowing where to start. You develop the skill of measuring how well they're doing with what you're doing. You learn the skill of changing what you're doing if the response isn't optimum. Okay? So you learn so many things, and it's always best, and believe me on this, it's always best to have a mentor. Just about every great person in the world has been mentored at some point in time by people who came before them. Tony Robbins, great golfers, great quarterbacks, great people in medicine and radiology. They had mentors, they had teachers, And one of the things that you're going to, that really you must have if you're going to really help your loved one get better, or if you're a therapist and you're not getting the results you want, you've got to have a mentor. And if you don't have a mentor, then you could, you could keep making the same old mistakes over and over and over for years and think you're getting better results, but it's insanity. So this is Mark Idelman, speech-language pathologist, sharing with you just a few things about the teaching of talking method and what you'll learn and what you'll develop and the skills you'll develop, and of course the results that you're going to get, which we always pursue better talking, not sign language, not iPads, none of that stuff. Is any of that stuff good? Well, it's not good for talking. It's okay for everything else, but it's not good for talking. What's good for talking? Talking is learning to help the person talk, not learning to teach them how to use an iPad. Okay? And it really takes a good mentor, and it takes regularity of practice. This is Mark Idelman, speech-language pathologist. If you like this video, please give us a thumbs up. And down below the video are a bunch of links. So if you'd like to contact me, or if you want me to have a free initial consultation with you, a free get acquainted visit, we can arrange that. If you'd like to be on our mailing list, we can arrange that. If you'd like to see our website, we can arrange that. Everything's down below the video. So I'd like to wish you a good day today, a good week, a good month, a good year, and a good lifetime. Just have a good one, and don't forget to hit the thumbs up and subscribe to our channel. Thanks a lot. Bye-bye now.